sink. I'm here to wash my hands, okay? You don't need to pull the curtain and blah, 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 because there's no patient involved other than just the introduction, okay? All right, so we're gonna go to the sink, okay? All right, whose bag is this? 'Cause I don't want it to get wet. And if you guys want to put your stuff in, oh no, that's students are here. So you can put it in the corners or whatever. Okay, so the first thing you're gonna do is turn on both faucets, okay? Anytime you turn on water, you always turn on both faucets. Write it down, okay? All right, so I'm gonna turn on both faucets and I'm gonna test my water. Always turn on both faucets and test your water, okay? Then I can adjust it as needed, okay? Now, this is what I'm seeing. I'm still seeing it. When you rinse your hands, you're going to rinse your hands and your wrist. This is what you guys are doing. Did you see my wrist get rinsed? Okay. Get that wrist in there. Some people do this thing. I love that. They do this. I love it. So, okay. Keep your hands pointed down, okay? Remember, that is a bold step. If you look on your paperwork, it's a bold step. It says keep your hands pointed down. This is not the time to pray, okay? Your hands should not come up. If they come up above your elbow, that is a bold step, okay? A lot of times, I know that you guys are nervous. I will say, keep your hands down. Okay, if it comes up again, I'll mark you off and you just failed already. Okay? All right. So, I understand you guys are testing and you have to test anxiety, okay? So, I'm going to do it like the students do. I love that. Okay? Because they make sure they get their wrist, okay? Then they put their hands down, okay? Then you're going to get some soap. Get a good lather because it says lather, okay? If I don't see lather, it's a bold step. You just failed. See how easy it is to fail? And you ain't even got out the gate. Keep your hands down. You're going to lather, okay? Make sure you get your wrist in between your fingers, okay? And your wrist. You're going to do this for 20 seconds. We always teach you guys 30 seconds, okay? Because you guys go, oh, 20! I'm looking at the clock. As soon as you put your hands together and you do this, I'm looking at the clock. So, okay, so if you do this at 3, boom, I'm going to do 20 seconds, 5, 10, 15, 20. So, if you come up before the 7 and put your hand under that water, you just failed. Okay? So, slow. Everything is slow. Now, the 1, the 2, some people sing the happy birthday. I don't care what you do. Okay? We just teach you to do 30 seconds so that even if you're going super fast, you'll still catch 20 seconds. Okay? So that's why you hear us say 30 seconds. Okay? All right. So now after 30 seconds, then you want to scrub your palms. Make sure you get that thumb. Okay? Both of them. Not just one. Okay? And then rinse your hands. Okay?
One at a time?
Yep. One at a time. Okay? And then what I can do, I got soap up here. Okay? Keep your hands apart. Okay? And see how I'm keeping them down? Then I want to step back and I want to look for soap. Make sure there's no soap, okay? Turn your hands, okay? Then I'm going to get my, okay? Get my wipes. I'm going to start with my fingers. Fingers first, okay? Do this. I see a lot of students doing that. That's perfect, okay? Don't go here. A lot of you guys go straight to the wrist because it's a habit. No, okay? Okay. Once you do your fingers, if you do this, then you can do this all you want to, okay? That's fine, okay? But it just has to be fingers first, okay? Or you can do this. I see some students doing that. That's fine, okay? All right. Then make sure it's completely dry. After it's dry, you're going to take another towel and shut off the faucet. After each skill, you're going to say, skill is complete. What are your questions? No questions? Yeah.
Can we do our
Yeah, I don't care. Knock yourself out. Takes more time. Great, which is great. Okay, next skill is stocking. This is done on a mannequin, okay? All right, so first thing I did was gather my equipment, right? Okay. I'm gonna gather my equipment. Put your equipment on your table, okay? Remember, your equipment will always tell you what to do, so put it on the table, okay, so you can see it. All right, so I'm going to do my entrance procedure. Hi, Miss Jones, it's me, Penny. I'm here to put on your stocking today. I'm going to wash my hands, pull my curtain for privacy. Now, for the curtain, okay, and you'll hear me say this on this test, you have to touch it, you have to pull it, you have to tug on it, whatever, okay? I have to touch it. Even if I do this, you will get credit, okay? You don't have to all just pull it all the way. But I have to see you touch it, tug on it, do something. You have to touch it in order to get credit, okay? So, all right, so the bed is low and locked. Same with this, okay? You can't just be like, bed is low and locked, okay? The, right here it says, okay? You must do what you say, okay? That's what that means. I can't say, I would pull the curtain for privacy, I would make sure the bed is low and locked, and I ain't never touched nothing, okay? I will pull the curtain for privacy, I will make sure my bed is low and locked. Perfect, okay? You must touch it, you must do what you say, okay? Now, the thing about it is what happens is students will say, I did pull my curtain, or I did say I pulled my curtain. You never touched it. I don't care what you're saying, okay? It makes no, okay? So remember that, okay? You must do, can you plug that up? All right, you must do what you say, okay? All right, so bed low and lock, prep my patient, never changes.
You want me to find the fan?
So you don't get too hot. Okay, now, minimal exposure, just the leg I'm working with, okay? Now, on this one, I know that this stocking can be hard to put on, okay? So make sure that you remember, you're gonna actually be putting stockings on a real person, okay? So, because you're working with a mannequin, and I don't care if you sit on the bed for the state test, who cares? But this is what y'all be doing.
Oh! That's so scary,
I
yeah.
had somebody literally do this.
How do you even? That don't make no sense.
Exactly. And I have to sit there and try to keep from laughing. Exactly. You see what I'm saying? This is what I be saying. That's why I have to walk out the room and all kind of stuff. Because I have to maintain professionality. Oh, y'all don't understand what I see on the state test. Okay, so first thing you're going to do is remember that this, just because it's a mannequin, you have to treat it like it's a real person, okay?
Yeah.
All right. Do not put the doggone sock on the heel. I don't know where y'all, how can you do that? I've never seen that. But I've seen 3 people put the sock on the heel. Okay, so what you're gonna do is you're gonna take your hand in, you're gonna find the heel of the stocking, okay? Put the heel of the stocking in the palm of your hand, okay? Then I'm gonna bring it down, just like a little doggy tongue. Leave a little doggy tongue, okay? I'm gonna keep my thumb out here because this thumb tells me that's where my heel is, okay? Then I'm just gonna come here and all I'm gonna do is turn it and take it off my hand. The heel is right here, okay? Then I'm gonna put it, just like you put your sock on, but I'm gonna open it because it's an elastic stocking, okay? And I'm gonna put it down as far as I can get it. Now, keep your hands in here because if you got nails, boy, this makes it hard, okay? And then pull it over, okay? All right. Once you get it over, okay, you want to make sure that the heel of the stocking is centered. Don't have, y'all be having the heel all up in here, all over here. No, check your work, okay? Because the heel has to be on the heel. Okay, make sure it's pretty much centered. Don't have to be perfectly centered. And when you're doing it, remember, you got a foot, okay? Your foot don't do this. So don't have it, y'all, this is what y'all be doing. And I'm looking like, you not want them taking care of me? Note to self. Okay, right, okay? So make sure that the heel is over the heel, toe is over the toe like a little hoodie, okay? Then I'm gonna take here, I'm just gonna go and make sure there's no wrinkles here along the edge here, okay? The ankle here, make sure of that. And then I'm gonna pull this up, okay? And make sure no wrinkles are here, okay? See how this is here, no wrinkles here. Double check your work. Heel is over the heel, toes over the toe, no wrinkles, looks good, okay? Now we're gonna do the exit procedure, okay? Exit procedure, cover car light, So now I'm going to cover the patient up, give them their call light, cover call light. Okay, bed is low and locked. Gonna open my curtain, wash my hands, skill complete. Questions?
Question.
Yes.
Do you wear gloves for something
No.
like this?
Okay, good question. Okay, so gloves will really complicate this. Okay, especially these little cheap gloves we got. Okay, you don't need gloves for anything. Okay, remember we talked about? So let me see. You can do anything with clean gloves on. When your gloves are dirty, you must remove them. You only need gloves with water skills and anything invasive, mouth care, bedpan, things like that, okay? So I got all these little cheat notes here for you guys, okay? All right. Okay, good question. All right. Any other questions with that? Don't be afraid to ask your questions, guys. This is your time, okay? All right, next skill.
It says stimulate. You can test.
Yes, ma'am. Y'all don't know me.
Oh.
Guess who's going to be the patient?
Hello. That's okay. Must we put in a manicure, or we are going to put it in an... Okay. The problem is, what about the feet?
You're talking about?
If my feet are big in a very
No.
Yeah.
This is done on a mannequin. Yeah, this is done on a mannequin. Remember I said it? This skill is done on a mannequin. Won't be on a real person. Okay. Now, another thing is, you guys don't know me. Never stand next to my bed. I've already got her.
Don't sit
'Cause I
on
will
it.
use you. Yeah, don't sit on my bed. See, she already know. You stand close to my bed or sit on my bed, you're gonna be the patient. So I already got her. That's how they chose you. Yeah. And take your shoes off. Put your shoes at the end of the bed. I got you. And hop under the sheet. Okay. What's my equipment for the skill? Gate belt. Yes. All right. Put my gate belt right here. Go ahead and take your shoes off. Okay. All right. Relax. Okay. All right, so I gather my equipment. I'm gonna go and I'm gonna do my entrance procedure. Hi, Miss Jones, it's me, Penny. And don't ask me on the state test. What's her name? Ask her!
See a different name.
Shoot.
Mr. Penny, I have a question.
Yeah.
Every time you go to room, you introduce yourself.
Of course.
Mhm. Yes.
When you go two years, two times, you introduce
No,
yourself.
just the first time, the initial. Okay? Because it's a different skill. It's like I'm coming in another time. Okay? All right. Good question. All right. So I'm coming in. Hi, Miss Jones. It's Miss Penny. And I don't care what you call them. Okay? A lot of people say Miss Divine. Fine. My name's Penny. I'm here to take you for a walk today. Okay? First thing I'm going to do is wash my hands and pull my curtain. Make sure my bed is low and locked. This is a critical element anytime you're getting the patient out of the bed. The bed has to be low and locked, okay? Prep your patient. Okay, remember it never changes. Assist, always assist, okay? Here's my assist. Miss Jones, we're gonna go ahead and sit you up. Okay, Miss Jones, we're gonna go ahead and bring your feet over. Scoot to the edge of the bed until your feet touch the floor, okay? That's my assist. You ain't got it. You guys, this is y'all assist. Sit back in. Okay, Miss Jones, we're going to get you up and we're going to sit. Y'all be cracking me up. I be trying not to laugh at y'all.
Oh my
Okay?
goodness.
But that's what y'all
That's
be doing. Okay?
okay.
You don't need to do all that, okay? All right, it ain't that serious. Make sure the feet are flat on the floor. This is a critical element, okay? Because sometimes people will, they'll be like, okay, scoot to the, because you tell your student or your patient, scoot to the edge of the bed until your feet touch the floor. They'll do this. Are my feet touching the floor? Right, because my heels are up. Okay, my heel is part of my foot. There's a bold step in there. Okay, you see it? You will fail right then and there. And she failed you. So that's why you'll see on here, you see me say, okay, knees need shoes. Number 3, knees need shoes. Okay, it's a dumb little saying, but it'll save you. Because you're going to check to make sure that her feet are on her floor, flat on the floor by pushing down on their knees. So if I got my heels up, if somebody pushes down on my knees, they go down. Okay, so knees need shoes. It reminds you to put shoes on. Okay, so making sure her feet are flat on the floor. Knees need shoes. Put shoes on. She can put her shoes on. Don't go trying to put her shoes on. It takes too much time. They can put them on quicker than you can, okay? While she's putting her shoes on, I'm going to grab my gait belt. Do not grab for your gait belt first. That's another mistake that a lot of you guys are making. You're grabbing for your gait belt first. No. Let her put her shoes on and then grab your gait belt. Okay. Now, with this, okay, what do these look like? Right. Because you chew with your teeth, then you swallow, okay? Chew first, then swallow, okay? So some of y'all be telling me, you know, I just like, Lord have mercy. So just remember that. Bring it around the waist. Make sure it's not twisted, okay? Chew first, like you open your mouth, you see your teeth. Make it a little snug, okay? Because it's going to loosen when she stands up. So make it a little snug, okay? And then swallow and tuck your tail, okay? All right, now, you have to brace the feet or the knees. So I'm going to make sure her feet are shoulder width apart. You can be toe to toe or knee to knee. Okay, don't matter. Okay, all right, but you have to be touching. This is not a brace. What am I bracing? The bed? Okay, don't do this. You will fail. Okay, so either toe to toe. I don't like toe to toe because it's like, right, and she's sitting as far as back as she can. Can you scoot closer? Whew, there we go. That helps. Okay, feet shoulder width apart. Okay, knee to knee. The bed is low, but I like knee to knee because in real life, when you're dealing with these elderly patients, right, they're gonna start dancing on you because you're gonna, be getting them up, and if you don't have them braced out real good, they're gonna start dancing. Okay, so if you got knee to knee, they start dancing on you. You hit that knee, they're coming straight up. Okay, so to help you keep the patient from falling. So knee to knee. Take the patient's hands and put them on the bed. Never let a patient wrap their hands around you, okay? Because if they start going down, guess who they're going to pull you down. And then both y'all on the floor, okay? All right. And you tell me, can you reach the bell? Can you reach the bell? Okay, call for help. Now, it's going to be an upward grasp, okay, on the side, okay? And make sure you bend. You see how I'm bending, okay? I'm squatting, okay? Count of 3, we're gonna stand. 1, 2, 3, okay? All right, now I'm gonna get out of her way, okay? It's an upward grasp, okay? It loosened a little bit, but it's not too bad, okay? If it loosens to the point where you gotta wrap it around your hand, sit her back down and do it again, okay? All right, so it's an upward grasp on the side and then the back turn. Okay, see my upward grasp? Okay, and raise your arm here. Okay, now another thing is, you see how I changed my hand position, okay? Okay, because I was here. Never have your hand in front of theirs, because if they fall, what do we do when we fall? We do this, right? If my hand is here, she can't do this, okay? So be behind, okay? So her hands are free. Okay, upward grasp, okay. Now, I'm gonna be behind her and pop out, okay? That's where you wanna be, okay? Not this. Not alongside, and not looking at the back of her ponytail, okay? Just pop out, and then scoot in, okay, what we read, okay? So just like you're over her shoulder, okay? All right, now we're gonna walk her. Now what I'm gonna do is the foot that she goes off of, I'm going off of that same foot. And we can walk like this all day, okay? And I'm gonna turn her. That way that keeps you from going like this, okay? Okay, go ahead. See how close I am on her? I'm literally pushing her a little bit, but see how much control I have? So if she goes down or whatever, I got control. I can pull her back or whatever, okay? All right, Now I'm gonna take her, turn her, step in front of her, okay? I gotta tell y'all this story. So I had a student who was testing, he was so nervous, right? He got to this part, right? And he couldn't figure out what to do, right? He was like, no, he's talking to himself. No. I don't know what he was just nervous. So finally he was so frustrated he just said,
Oh my goodness.
right, yeah. They didn't think that. This is what happened. Yeah. So I have to maintain a professional face and not laugh.
So at least that line was safe for the
Right. So a lot of times I'll go behind that wall and be cracking up because so all you gotta do is turn her and step in front. Okay, you gotta be in front of your patient. I've seen a lot of you guys on the side here. No. You always have to be in front of your patient, okay? Go ahead and have a seat. Okay, take her gait belt off. All right, now I can tell her to take her shoes off because she can do it faster than I can. Miss Jones, go ahead and take your shoes off. Put that back here. Assist your patient back into the bed. Okay, this is y'all. I love it because y'all I'm like, y'all over here working y'all back before y'all even really get out here. Okay, so come on back over here. All you gotta do, okay, Miss Jones, gonna go ahead and get you back in bed. Eventually, she's gonna do her own stuff. It's a test, people. Okay? All right, cover call light. Okay. Bed low and locked. Open curtain. Wash hands. Skill complete. Questions? Okay.
Just laughing.
Okay. What's my next skill? Stay for me.
This was used with a bedpan.
Okay. The dreaded bedpan. All right. So, tell me my materials that I need.
Bedpan.
Uh-huh.
And then
Okay. And gloves. How many pair of gloves do I need?
two.
Yeah. Right. Okay, this is the only skill where you need multiple pairs of gloves, okay? All right, so put your equipment out here, okay? And I'm gonna get my 2 pairs of gloves. Okay. All right, I'll put all your equipment out here, so don't put all your gloves here and then just be like, okay. Just put them, they're individual, okay? So I know I got 2 pairs of gloves, okay? Got my equipment, okay? So, I'm gonna come in. Hi, Miss Jones. It's me, Penny. I'm here to put you on the bedpan today, okay? I'm gonna wash my hands. Pull my curtain for privacy. Make sure my bed is low and locked. Prep my patient. There's always a prep when you have a patient, okay? This is one of the most important. Okay, minimal exposure, just what I'm working with, okay? Then I'm gonna look at my equipment. What do you guys think I should do next?
Gloves.
Right, if you see gloves, put them on, okay? All right. Remember, you can do anything with clean gloves. Clean gloves is like clean hands, okay? All right, I could do 1 or 2 things next. What do you think I should do?
Give the patient the tissue.
Yes. Okay, because we're still prepping our patient, right?
Yeah.
Okay. So what do I have to do with this? I have to keep it in my hands first. What do I have to do with it?
Give it to her.
Hand to the patient.
Okay.
Telling her.
What about the wipes?
You should open them. Just when you're
No,
done,
don't
you
open
can wash your hands.
That's right. I have to tell her what to do with the wipes. If you look at your paperwork, it says, okay, to tell the patient what to do with their wipes. Okay? I'm working on it. Okay. I'm done with that. Okay, so I'm going to give her the toilet tissue because she knows what to do with this, right? If she don't, okay, here you go. Here's your toilet tissue. And here's your wipes to clean your hands after you're finished. Okay? Now, I'm going to go back here. I'm going to get my bedpan. Bedpan goes pour side, because I poured in the toilet this way, okay? Pour side towards the patient's feet. Pour side towards the patient's feet, okay? Now, when you hold the bedpan, now you pretend like it's dirty, okay? You cannot touch anything. So think now, my hands are dirty, okay? Gloves are dirty now, okay? So I can't touch anything. So what I'm gonna do is I'm gonna tell my patient what I want her to do. Miss Jones, can you please bend your knees and lift your bum? Bridge up for me. Okay? Come on, girl, lift your bum. I ain't say roll over. I said lift your bum. Bend your knees and lift. There. And step back. Okay? Don't touch anything because remember my gloves are dirty. Okay? This is what y'all do. Let me do it. Take it out. Okay. You ready? Okay. All right. All right. Miss Jones, can you please bend your knees and lift your bum? Lift your bum, Miss Jones. Yeah. Okay. And this is what y'all do. Trust me. You're going to encounter, when you're out there, patients are going to call you for the bedpan. They done already crapped and pissed and everything else, okay? And you're going to be like, now I know what she was saying, step back and take your gloves off, okay? Because if she's done already started going, now I got boo-boo everywhere. Okay? All right? So, you're going to step back. Take your gloves off. When you take your gloves off, you take it off palms first. Always, always. Palms first. Make it disappear. Go underneath without touching the outside of the glove and contaminating your hands. You take off your gloves, wash your hands. So let me see if it's on one of these skills. So when it says, I'll show you here. When it says remove your gloves. Where you at? Where you reading? Okay, number 6. Okay, you see where it says number 6? Remove and dispose of, but without contaminating self. This is where you guys, so you be like, and wash your hands is right there, okay? So, there's 2 things you got to remember when you take off gloves. First of all, to take them off correctly, okay? So, a lot of you guys will be like, but I did that, but you didn't do it correctly, and that's why you missed it. So this is why we teach you when you take off gloves, always, always take them off palms first, okay? Because without contaminating self, okay? Because if I take off gloves like this is what y'all do. What did I just do? Right, exactly. Okay? You can't do this or do this. That's why we say palms first, okay? That's what we're looking for when it says without contaminating self, okay? Because if I do this, even, some of y'all stay away from here. Stay away, okay? Palms first. Gloves off, make it disappear, go underneath without touching. Take off gloves, wash your hands. Because, see, you would have just missed that step because of 2 things. Okay, now, I'm done, all right? Now what I got to do?
Raise the head of the bed.
That's right. Because you do not go to the bathroom laying down. At least you're not supposed to. Okay? So I'm not. Anyway, okay. First thing I'm going to do is I'm going to bring the head of that bed up. Okay? Bring it up high enough to make sure that you remember to bring it down. So some of y'all will just barely touch it and then you'll forget to bring it down. Okay? Make sure she got a call light. Because cover, call light, right? And head of the bed goes up, okay? Doesn't matter which one you do first, just remember to do them all, okay? Cover, call light, head of the bed goes up. Miss Jones, call me when you're done. I'm gonna step outside the room after my little white line that we, okay? All right. You done, Miss Jones? Dang, I got 5 other patients. Okay, all right, so she's done. So I'm gonna come here, okay? I'm not going to Mrs. Jones when she calls me, okay? Beep, she calls, okay? First thing I'm gonna do is what?
Put the gloves.
The gloves.
Fine, because remember, my equipment tells me what to do. And I can do anything with clean gloves, right? So I'm gonna put them gloves on. Now what else I'm gonna do? Why am I over here?
And then
No,
uncover.
no,
No,
No.
pick up the tissue and the wet.
no.
Lower the head of her bed.
Thank you. That's why I'm here, okay?
Oh, yeah.
This is supposed to be over here, okay? Okay, so, lower what goes up must come down, okay? So let's do this part again, okay? I'm gonna put this over here so that'll help you guys, okay? All right, beep, she's done. What'd you say I do?
Put your gloves.
Put the gloves.
And you can wash your hands if you want to wash your hands, put on gloves, I don't care. It's when you take them off that it's gonna count against you, okay? All right, now what I gotta do?
Lower the head of her
There you
bed.
go, okay? Oops. All right. All the way down, okay? Okay. All right, Miss Jones. Got clean gloves, so I can do anything with clean gloves. Minimal exposure. Miss Jones, go ahead and bend your knees and lift your bum. Okay, Miss Jones, go ahead and cover yourself, okay? Tell her to cover herself because she has to, if you look in there, it says make sure the patient stays covered, okay? All right, so I'm gonna go in here. And you don't have to worry about, oh, well, you know, my gloves are dirty, so I don't have to, doesn't matter, okay? All right. Don't rinse, you have to actually rinse, okay? You never have to dry the bedpan, okay? Put it in the soiled utility room. Right there at the soiled utility room, because you got on dirty gloves, take off your gloves. How do I take off my gloves? First, make it disappear. Go underneath without touching the outside of my gloves and contaminating my hands. After I take off my gloves, wash my hands. That's why I let the water run, okay? Back to the patient, exit procedure. Cover call light, cover call light, bed low and lock. Open curtain, wash hands. Skill completed. Questions? Don't have to worry about taking it back.
How do you rinse the bedpan if your gloves are dirty?
Don't have to worry about it. It's not a part of the test.
Or like practically?
Oh, in real life, you would do this. If I had my bedpan, a couple of ways I can do it. Okay? Or, okay? But for the state test, you don't have to worry about it, okay? But if you do that on the state test, just practice.
Practicing ourselves. I'm just curious.
You don't practice here.
Oh, we don't practice here?
No, I'm showing you all the skills.
This is what?
This is, yeah. This is to show you all the skills. Right. Yeah.
I feel like I should be good at this.
Oh, well, I'm sorry.
No, it's not your fault. I'm just like impatient.
Oh, okay. Well, you don't have to stay.
That's true.
Yeah. Okay, so next skill. What's my next skill?
Cleans upper and lower dentures.
What we say?
Denture.
Dentures.
We have
Okay.
one more question over here.
Yes, ma'am.
When was the toilet paper and wipes disposed of?
Oh, you can do it many
Anytime.
times.
Oh, okay.
Yeah, you can leave them on the table. You don't have to go because they're not a part of your skill. It doesn't say put them away. Okay. If it says put it away, it's going to be like in the dirty designated area. If it doesn't say put it away, it doesn't count against you. Okay? All right, so now we're on dentures. Now, dentures is a stationary skill, right?
Sorry.
Okay, so this means no patient involved, right? Okay. Okay. No patient involved. This is going to be set up for you, okay? As far as this, the equipment portion. You'll have to get your, let's see if they, there. Okay. You will have to get your, so it'll be just like this, okay? Now, what's the first thing I have to get?
The
That's
paper.
right, gloves. Don't forget that, guys. Okay, don't start messing around with that equipment and you haven't gotten gloves on, okay? I'm gonna put my gloves. Anytime I'm dealing with a water skill, I'm gonna get a size bigger than I normally wear, okay? All right, now I'm gonna set up my equipment. You know how we will prep our patient? We're gonna prep our equipment on the skills that doesn't have a patient involved. So I'm going to line my sink, okay? And I'm going to line my equipment.
So it's okay to put paper towel.
Yeah.
Okay, so it doesn't need to be like a towel now.
Doesn't have to be. All right, now I'm going to turn on both faucets. This one is a critical element. Okay, if you look on your stuff, it says moderate temperature. Okay, how do I know it's a moderate temperature?
You put both of them.
Right,
Test
I got
it.
to test it and I got to turn on both faucets. Okay, that's why you hear me always say both faucets. Okay, because if you do this, even if you test it, I've had students do this, turn on the cold. It says moderate temperature. Okay, even if you do this, you're going to fail that. And there's like 3 or 4 skills that says moderate temperature. So that's why we always tell you, always turn on both faucets and test the
Test
water.
it.
Okay? All right. So you don't want this to feel too much. So kind of bring that in. Now I'm gonna put my gloves on, okay? All right. Okay, so now on this one, you're going to rinse everything. Doesn't matter where you start, okay? All right, so I'm gonna start with this. Rinse this out. I'll get my dentures. Take that, rinse those. Put those in the emesis basin. You take the emesis basin, dump the old water out, rinse the bottom, the back of it, and the inside cup and lid, okay? Because you see on there it says cup and lid, okay? Fill it half filled with water, okay? Got my toothbrush. Anytime you have a toothbrush, 3 things. You have to rinse it before and after, and it has to be on a clean surface, okay? Okay, do that. And put a little bit of toothpaste on, okay? All right, now I'm going to rinse this again, because I don't know, maybe I forgot. I'm testing that. Okay, then I'm going to clean all surfaces of the dentures, including the edges, okay? I'm going to flip it, get the roof of the mouth, and the teeth. All surfaces of the dentures, including the edges, okay? All right. I'm going to rinse that. And then I'm going to put the clean dentures in the clean water, close that up. I'm going to rinse off my toothbrush.
Yes, then will I be talking?
You can talk if you want to.
Okay.
I like to talk. I like for people to talk. And rinse this, okay, because it had dirty dentures in it, okay? Remember, that toothpaste can stay there because it's on a clean surface, okay? And I'm going to dry this out. You want to always dry everything except the bedpan, okay? And even if you dry the bedpan, I don't care, okay? Just remember, okay? And then this has to go back in here. You look at your paper, it says so. So if you was to leave it out here and this, I would mark you off, right? So remember, it has to go back there, okay? Put this here. 1, 2, says make sure, take that out. Dump that, gloves off, palms first. Make it disappear. Go underneath without touching the outside of your gloves and contaminating your hands. Take off my gloves, wash my hands. Skill complete. Questions? Good?
I have a question.
Mm-hmm.
Just because I couldn't see. So did you fill the sink up?
Mm-hmm.
What's the purpose of that?
So I put the liner here so that, good point. So dentures are made of porcelain. So porcelain on porcelain will break. This is a stainless steel sink, but porcelain usually on porcelain will break. And so it's to keep the dentures from breaking. Good
And
point.
then you wash them over the sink.
Mm-hmm,
with
yeah.
water?
Mm-hmm, yep. Okay, where's my partners? That's testing. My partners.
Oh, and another thing is when you're washing them, always they must be low.
You don't have to worry about that. Only on hand one. It's you and where's your partner? Who was the partner? Okay. All right, you guys. Now everybody else grab a partner. Students, you guys should have this packet now, right? Go ahead and can I give you the extra paper? So go and get this for all of the students. Okay.
Oh, where did I put my paper?
Okay, so students, you guys are gonna start your recording. Okay, this is the students, okay? So put your name on that sheet, okay? Grab your partner, put your partner name here. Okay, you're gonna do the blood pressure, the weight, you're gonna do all these skills today, okay? So have her make a bunch of copies of that. Okay, everybody else?
Okay, we can prepare tonight.
She's gonna go make a bunch of copies.
Oh, yeah.
Okay, if you don't have that, she's gonna make a bunch of
Let
copies.
me ask her.
Okay, where's my partner?
Done.
Okay. Did you go in there with them? That's my cousin, go. Okay, when you guys hop on the bed, take your shoes off. They're in there in the bedroom.
Everybody in there.
Oh, they must have fixed it.
Okay, go ahead. Do your style talk.
Can
Okay.
I have a partner from the school?
Yeah, you can have a
I can-
partner wherever. I don't know. Okay, now,
Let's
let's talk about, go ahead and grab a partner. Everybody grab a partner. If your partner's not here, just grab somebody else that's testing with you that day. Students, grab anybody, okay? Okay, now we're going to talk about the vital signs, okay? So what is your normal pulse? 60 to 100, okay? 60 to 100. You need to know your normals, okay? All right. Because 60 is 1 full minute, okay? Remember, you're going to take your measurement for 1 full minute, okay? All right. So, where am I going to feel for the pulse?
On the wrist.
Okay, right. Thumb side. Patient's thumb side. 2 fingers, patient's thumb side. Okay? All right. So right now what we're all going to do is we're going to do our own pulse. Okay? So you're going to be your first patient. Okay? So on your paperwork, before we get started, okay, she's working on it. Right? If you've got your paper, put your name here. Okay? So your name's go here and here. You're going to be your first patient. Because you need to know your baseline, okay? But put yours first. You're going to be your first patient. Put your name.
Okay, then no.
And then what's your name? She's going to bring the papers in and then you guys can do that, okay? All right, so everybody just remember your numbers, okay? So we're going to take our own pulses. Who else needs papers? She's got the papers.
She needs a paper too.
Okay. Okay, whoever needs a paper, come in here. Okay. All right. So go ahead and put your name on that paper. Keep this sheet, guys. Do not lose that sheet. Students and outside students. Okay? Let me see if we need. Okay, hold on. I'm gonna have to make some more now. Oh.